So we always talk about how technology is rewriting everything. And we witnessed yesterday in our AI for Healthcare conference that healthcare is actually, organizations are actually rewriting the digital transformation at this time. They're transforming care, they're working with regulations, and they're changing history. So, Savitha, what was the healthcare conference, AI conference about? And tell us about the speakers that you heard.
Yeah, of course. So our goals with the AI and healthcare breakout session were very simple but ambitious. Yeah. We wanted to really bring together experts from 3 adjacent disciplines that are really at the forefront of healthcare innovation. So first and foremost is clinical practitioners. And we wanted to include both physicians and nursing, and we had those voices represented. We wanted to, combine that with obviously the digital and enterprise IT leaders that drive programs at scale in these organizations. And together, last but not least, we needed those operational and governance leaders in the room. So we brought together this panel of speakers that are just incredible leaders within their respective healthcare organizations for an amazing day. We had so much dialogue, so much insight and back and forth between the speakers and the audience. As an example, so we opened our session with Dr. Patrick Guffey, Chief Medical Information Officer of Children's Health Colorado. He really set the stage. He gave us some kind of foundational facts about healthcare, and that set the stage to have more nuanced conversation. We followed that up with a conversational panel. We invited one of our external healthcare innovation partners, General Catalyst Brad Rose. He's one of the most connected voices in healthcare innovation, given that he's the architect of the General Catalyst Health Assurance Partnership.
Right.
He manages partnerships with 23 other health systems. So he led a very thoughtful conversation with Dr. Graham Walker from Kaiser Permanente, Northern California, Clarette Presley recently from Sutter Health, and Mike Ruhmkorff from City of Hope. That was a very insightful panel discussion.
It was.
We followed that up with Ryan Smith, Chief Digital and Information Officer of Intermountain Health. And he really shared what enterprise AI at scale could look like in a health system. Very inspiring, and I think the audience got a lot out of it. And then we wrapped up the keynotes with Dr. Adam Weinstein of DaVita, who showed us really how, DaVita is different from a health system and how they think about AI in healthcare. We brought this all together in a panel discussion, bringing in operational leaders, Trace3's very own Sarah Sample-Reif, together with Jason Peoples of Mary Free Bed, who's kind of operationally leading the charge at Mary Free Bed, together with Dr. Aaron Wilcox of Southern California Kaiser Permanente, and John Friesen of Geisinger Health. So we had these incredible voices, very insightful perspectives, lots of learning, and lots of engagement with the audience. So I think it was an amazing set of speakers we brought together. On that topic, Sarah, I was thinking, as we were looking at, listening to the talks, it seemed like there were some themes that kept bubbling up. Every speaker, every panelist was kind of highlighting similar problems, and it resonated with each other. And in some other cases, there were some unique, challenges or themes that some of the speakers brought up. What did you think about the themes during the session yesterday?
I heard loud and clear that all of the voices need to be heard in the room for governance and for selecting solutions. Also that we need solutions not looking for problems, but problems looking for solutions, right? I heard that throughout every single conversation. And then that governance is so important as we go through that to make sure that we're transforming care and not just putting a solution in that can be open-ended. So I think that was a really big key in the entire conversation.
Yeah.
So, Rish, how does Trace3 help us with these solutions?
So let me back up for a minute here. As we were sitting through the session, and we've done 6 of these, there is a journey you start to see. When we started doing it in 2019, we were talking about the prospect of AI. And it was, to your point, more of a solution looking for a problem. But we were just trying to highlight, as a technology partner, what's coming down on the horizon. And the last 3 sessions, we did one in February last year, another one at Evolve last year, this time, and now this one. The technology part is well understood. But there is, Dr. Weinstein called it the FUD factor associated with this massively high. Dr. Wilcox talked about, how do we make sure we don't squander the opportunity like we did with EMRs. That became a system that everybody had to design around their life, around their process around, and not the other way around. So yes, we are a technology partner. Yes, we are focused on elite engineering. Yes, we are going to make sure that we are trained up on that. As a matter of fact, you both know this, a massive investment we made in the company in training people on AI, the Legends program we launched. So we've achieved a baseline of AI knowledge. But then came the hard part of adoption of it. So we had to eat our own dog food, drink our own champagne, choose your expression there. And that's been the hardest part for us from an adoption perspective. And we're a technology-first company. Now compare that to a healthcare organization. The big epiphany was that, and Brad called it out, that technology is 50% of the problem. What's the remaining 50%? That is the enablement element. So how do we play a part in human-centric design with security and privacy by design at the outset, and then make sure that the cultural shift happens, process reinvention happens with our support, and we take it all the way to change management, learning, and development. Those are things I think we really have to think about, and we've invested in that. Our management consulting practice over the last 6-7 years has grown massively on the back of the change management, change enablement aspect. So I think we're very well positioned on that front. However, there is one point that, Savitha, I think you're awfully close to, and I'd love your thoughts on this, is every industry is at a certain maturity level from the innovation curve, shall we say. So you've been tracking the innovation lens, the research lens, the VC lens for quite some time, and you made healthcare your passion project. I'd love for you to share with us, how are you seeing healthcare on that innovation curve now?
Yeah. That's a really interesting question. So I think if we look back at the last maybe 2-3 decades, I would say the innovation in healthcare was measured, cautious. Perhaps in the early 2000s, the Human Genome Project, that was one of the first major breakthroughs. And it took years for that to make its way into day-to-day practice. So, and for the right reasons, right? I mean, you've got all this regulatory pressure, you've got health systems with a high degree of rigor, patient, the criticality of patient safety, is tantamount. So all of these are the reasons why perhaps technology or fintech, some of the other industries were going, much faster. But just look at the last 10 years. I would say healthcare has just leaped forward in that sort of innovation journey. Today, and even in the last 10, just look at the last 5, right? So look at between AI-powered diagnostics, take a look at examples in radiology and pathology. AI-powered diagnostics is now detecting cancer earlier and earlier. You've got personalized medicine in multiple specialties. You've got care at home is now a reality. You've got remote patient monitoring. I'm even starting to see AI-powered screenings for behavioral health, for neurocare, and we're watching all the startups in this area. So it's fundamentally healthcare as an industry has transformed. I think it's now in this mode of continuous reinvention rather than, kind of episodic change. And there's never been a more exciting time really to be part of this, this innovation cycle in healthcare. And the other shift I'm seeing is now the ecosystem is much more open. So it's no longer that each health system or, anybody in the ecosystem has to innovate on their own. The environment is much more collaborative and open. And as we saw with, for example, General Catalyst now, I think the healthcare venture capitalists have an important, interesting role to play in this. In addition to making their bold investments and their portfolio companies, they're actually serving as a catalyst to drive change, and they're partnering, right?
No pun intended, right?
Yes, no pun intended. Exactly. So, yeah. I'm so excited. There's never been a more exciting time to be at the forefront of change and innovation in healthcare.
I agree, and I think that that's led us into so many of the conversations we had yesterday. When you talk about the change in healthcare, they talked about the pajama time, right? No other industry has pajama time.
Right.
No other industry is going home and writing notes into their systems. So,
So I'm curious, what do you see for healthcare with tech on the horizon, with all your background?
thank you. I think that healthcare is going to continue to grow. It's going to continue to innovate. They're going to collaborate.
Yeah.
So precision medicine, like you mentioned, genomics, that's definitely going to continue to grow, and organizations are excited about creating that innovation and having those steps forward in healthcare.
It's a strange time in healthcare, let's face it, right? I mean, the macroeconomics are scary, to say the least. The reimbursement rates are down for providers, so we're seeing budget cuts happen everywhere because of the uncertainty that the organizations are feeling, let's face it. And with the upcoming regulatory changes, the scenario could be much worse for providers. And there is going to be a domino effect on the payers as well. And there are changes happening in the pharma and life sciences, again, driven by the regulatory pressures. But, one thing that we've all realized is, as a company, is that change is necessitated by crisis. One thing that baffled me when I joined Trace3, by the way, was that in 2006, the company was 42 million in revenue. Would you want to venture a guess when Trace3 hit 100 million in revenue? 2008, at the depth of the financial crisis. My point is, crisis almost always breeds opportunity. And for healthcare at a macro scale, there is an opportunity as well. So the great upside of the medical records boom, the great upside of the digital transformation that was enforced on healthcare as a sector, payer, provider, life sciences, what have you, has been that there is better data, more data, structured and unstructured, that creates opportunity. Yes, there are macroeconomic pressures. Yes, there is a doctor shortage, but if we can innovate, if we can create new products on the back of this data, on the back of, let's say, AI, automation, what have you, choose your flavor, I think the future is going to be brighter. I think more people will have better access and equity, and frankly, we can get out of the burnout zone that our providers have been in as well.
Yeah.
So, exciting times ahead.
Completely agree. So, what's next then, Sarah? As our clients are continuing on this journey of technology innovation and solving their business challenges, what's next?
I think, one of the things we heard over and over is that it is going to augment care, not replace care.
Right.
As you mentioned, remote patient monitoring was never even a consideration, and now healthcare at home is on the horizon. I think the patients are at the center of all of this, and making sure that it's human-centered care and human-centered AI.
Indeed. I think the future is bright. It's going to be challenging. It's going to be twisted paths to success, but I think it's on the horizon. It's interesting to see what's happening worldwide at this point. We're seeing in the East, and I'm sure, Savitha, you're tracking it a heck of a lot closer than I am. In the East, people are adopting AI models big time. And because they have access to it, they're using it for diagnosis, for better or for worse. But there may be a future of healthcare delivery that may be built on the back of data that comes out of the eastern part of the world. And that may augment how we in the West think about it in our realm. Of course, with the security and privacy guardrails in mind on our side.
Yeah. And that probably has two sides to it, right?
Totally.
In terms of the regulatory compliance, some of the challenges that our speakers shared.
Yeah.
But yeah, I would agree with you.